Good afternoon, everyone. Thank you so much for tuning into today's webinar on 211 and clinical community connections. It is noon, so we're going to go ahead and get started. This is the 6th and final webinar in our summer webinar series. My name is Alana Krober, and I'm the Director of Information Services here at United Way of Connecticut 211. A few housekeeping items before we begin. Number one, participants' audio is going to be muted throughout the webinar. However, you can use the Q&A box in your webinar controls to chat in any questions you might have. And I hope to have a few minutes at the end to answer them, but if not, we will certainly provide written answers to all questions in a follow-up email. And secondly, the PowerPoint from today, as well as the webinar recording, will be emailed to all registrants in the next few days, and the recording will also be posted on our website. Okay. So let's get started. Here's a quick snapshot of what we'll be covering over the next 30 minutes or so. 30 minutes is not a lot of time to cover a topic this big, so our main objectives will be to provide some brief background on 211 and health-related social needs, describe some of the common features in programs aimed at that clinical community integration, and then spend most of the time talking about how 211 can support the efforts of clinical community integration. If there's time, I'll try and also squeeze in a short demo of the 211 website. But for a detailed overview of 211 and all of our services, as well as a comprehensive tutorial on how to use the website, I would direct you to the recording from our first webinar of the series, which can be found at this link at the bottom of the slide. Okay, so I know most of you are probably familiar with 211 and who we are and what we do, but for those of you who may not be, I want to provide just a minute or two of background. 211, like 911 or 411, is a national 3-digit dialing code that was created to make it easier for individuals to connect to important health and human service information and resources. So there are over 200 independently operated 211s across the country right now, and many of them, like ours, are operated by and are funded by United Ways. Also, many, again like ours, are blended call centers, meaning that we handle both information and referral calls, as well as crisis intervention and suicide prevention calls. Many states have many 211s that operate within them. So they'll have 211s that cover a large city or urban area, or a 211 that covers some portion of the counties within that state. In Connecticut, we're lucky we have just one 211 service that serves the entire state. So in Connecticut, anyone can dial the toll-free, easy-to-remember 3-digit dialing code and can reach one of our contact specialists 24 hours a day, 7 days a week, 365 days a year. Calls into 211 are anonymous and private, and the contact specialist here provides supportive listening. They'll do a brief screening to determine primary needs and then provide referrals to relevant community resources to meet those needs. 211 Connecticut has been working hard to get individuals connected to community resources for 42 years, and 211s across the country have also been engaged in this work for decades, which is why many 211s are playing an increasing role in grants and pilot programs and demonstration projects aimed at improving health outcomes by addressing unmet social needs. So our goal today is to describe all the various ways that you all, in your hospitals, in your health centers, and in your community-based organizations, can use 211 to support whatever efforts you currently have underway to address the social determinants of health and provide stronger links between those clinical and community providers. But before we jump in, let's talk briefly about those health-related social needs. So what do we mean when we say health-related social needs, or social determinants of health, or social drivers of wellness, or social comorbidities? There are dozens of descriptors being used right now, but they are all getting at the same thing, right? What are the social and economic and financial needs individuals have that impact their health? So some of the big contributing factors are housing instability, food insecurity, inconsistent utility service, and underemployment, and lack of transportation. And of course, there are many, many others that we could list here as well. And there is widespread recognition, I think, at this point that these social needs play a critical role in determining one's health. In fact, some literature estimates that up to 80% of an individual's health outcomes are determined by factors unrelated to their actual medical care. That's huge, and that's why these discussions and the intervention programs being tested and tried across the country are so important. And as those programs and interventions aimed at connecting the clinical and the community are being developed, there has been a recognition that 2-on-1s have an important role to play as well. So in 2016, the American Academy of Pediatrics issued a report on the health outcomes of childhood poverty. The report and supporting documents recommend that pediatricians actively seek to screen patients for poverty risk factors during checkups and recommend referral to additional services, including 2-on-1. Also, when the Centers for Medicare and Medicaid Services, CMS, released the funding opportunity in 2016 for the Accountable Health Communities model, which is the largest demonstration project to date in this area, they too offered 2-on-1s as a potential partner in this work. And on a local level, we here at 2-on-1 Connecticut are indeed a partner in the grant received by Danbury Hospital and their 6-hospital consortium. Okay, so what kind of interventions are we talking about? What exactly are healthcare systems and cities and states and others doing right now to address health-related social needs? Most basically, they are trying to achieve better integration between the clinical care someone is receiving, right, the healthcare delivery system, and the community-based organizations that provide critical basic needs services and social supports. And through that integration, providers are trying to do many things. They're trying to improve health outcomes, reduce costs, align resources and activities that improve whole person health, reduce health disparities, advance health equity, and more. And there's really no one-size-fits-all approach here. There are many different models and partnership arrangements. Some are big, some are small. Some are just trying to implement a referral program right now, while others are looking to provide a coordinated clinical community service, and others are even offering joint services. Whatever the particular model, though, 2-on-1 can help be a bridge between those two sides. And even though the clinical community integration programs that are currently being developed come in many shapes and sizes, they do often tend to have the same core set of features. So these features are screening tools, resource directories, referral making and tracking, data sharing and communication, and lastly, identifying and addressing resource gaps. And regardless of where you are or which features of a clinical community integration program you are currently focusing on, 2-on-1 has some tools to help support those efforts. So one of the most challenging pieces to developing these systems can be the screening mechanism. And yet it is also the foundational step in this whole process. We can't address someone's unmet social needs without first identifying them, right? And while those of us who work in social services are well trained in doing these assessments, clinical providers often are not and need a standardized tool they can administer or have patients self-administer. Having patients dial 2-on-1 to be screened by one of our contact specialists is always an option, but there are some other tools too. So we offer one tool on our website for free called the 2-on-1 Navigator. It's a 2-minute anonymous screening tool that anyone can complete. It does not screen specifically for needs, but it does screen for potential eligibility for 23 state and federal benefit programs, which can be really helpful. However, many providers will want to also use a tool that screens for and identifies categories of needs, like transportation, housing, food, utilities. And we are happy to work with providers to crosswalk their particular screening tool questions to the resources in the 211 database. We have done this already for some of the partners using the assessment tool developed by the Connecticut Hospital Association. And on a national level, the taxonomy of service terms used by all accredited 211s has been crosswalked to the screening tool being used in all of the CMS Accountable Health Communities projects across the country, including the ones being led here in Connecticut by Yale and Danbury Hospital. So once providers have identified patient unmet social needs, they then need a directory or database of resources from which to pull from to address those needs. And there is increasing recognition that this needs to be a modernized resource directory. In a 2016 article from Health Affairs about the Accountable Health Communities model, the authors write, "A comprehensive searchable resource database is a necessity. Binders or Excel spreadsheets updated in 2011 do not work for information to guide patients' clinical care and will not work for their social needs either." 211 Connecticut has the state's comprehensive searchable database of community resources, with 4,000 agencies listed in it, 40,000 programs, and 400 e-library white papers. The database is maintained continuously by 6 full-time resource specialists, is updated every day, all day, and is available for the public to search on our website, 211ct.org, where search results can be easily filtered by radius, age, gender, target population, or day of the week to help users quickly find the most appropriate resources. And as the industry that provides social determinant of health technology begins to grow or continues to grow, we at 211 Connecticut are working really hard to see if we can integrate our resource database, that database of 4,000 agencies and 40,000 programs, into some of those technologies, so that if a healthcare system wants to bring on a software that helps do the social needs screening and patient tracking, that they are also able to search and refer to resources from the 211 database within that same platform. Okay, so just one additional slide here still related to resource directories. Many of you may be familiar with the types of programs in the 211 database, but for those of you who are not, I wanted to give you a sample of some of the services you will find. So we have food pantries and other emergency and safety net food resources, in-home assistance for older adults, transportation options, programs by disease condition like asthma or diabetes, support groups, exercise classes, and wellness programs, to just name a few. And some of these categories are new to the database in the last 5 years or so, because as we have been engaging in these conversations with providers at the safety net clinics, at the community health centers, at hospitals, we've been hearing from providers about what types of resources they're looking for. We've been hearing from them that they want to be able to find a free yoga class or a nutrition class or an exercise class for a patient that's sitting in front of them. And so we've worked really hard over the last few years to increase the amount of resources in those areas, in those non-traditional wellness areas that we have in the 211 database. And we continue to work towards that. But the only way that we can continue to add things is by hearing feedback from providers in the community. So we really encourage folks to reach out to us to tell us, what are you looking for? What kinds of resources do you need to find for the patients you're working for that you're not able to find right now, so that we can continue to work hard to improve in those areas. Okay, and of course, identifying the community resources is great, but then those who are working with the patients, right, so the community health workers, the patient navigators, the social workers, the providers, need a mechanism by which to make those referrals. And this mechanism can be as simple as a paper social needs prescription pad with written or printed referrals, or it can be as sophisticated as a client record management software with a closed loop referral functionality, one of which we're actually piloting use of at 211 right now to better understand its applications. But regardless, we want to make sure folks know about the free tools we have added to 211ct.org to make sharing and tracking resource referrals easier. So now, from the 211 website, you can share any resource with a patient by email or text message. You can also print out a hard copy of a resource for those patients who need something written or tangible to walk out the door with. Or you can grab the shareable link to any resource in our database and embed it in a separate email or share it any way you want. Additionally, we have also added My 211 account to the website, which is a free account that anyone can sign up for. It allows users to create and save customized resource lists that can be used as personal action plans or care plans. We have heard from navigators and community health workers that this has been a great tool for pulling together resources that meet all of a patient's needs, and then being able to email it or print it out for them. Plus, having that saved record of the list to reference when they speak to the patient again has been incredibly helpful. Okay, so number 4, data sharing and communication. So creating ways to rapidly share health and resource information across systems is a big goal of many clinical community integration efforts. And it's also a big challenge. So bidirectional communication and EHR integration are some of the biggest challenges. And we know how critically important these components are and have been taking steps to allow for greater data sharing and communication with regards to the 211 resource data and the 211 call data. So most significantly, we recently created an API, or application programming interface, for our 211 database search that opens up doors for other applications like websites and software to query our resource database and then pull the results into their own application to display. So one good example of this is myplacect.org. So that website now has a 211 integrated search on their website. If you want more information about our API or want to view the documentation for the API, please reach out to me directly, and I'm happy to have those conversations. We have also just released the 211 community comment feature to the website, which you can get a sense for in the screenshots at the bottom of the slide. And this feature allows users with a My 211 account to post updates and edits to programs on the website in real time to encourage bidirectional communication and a more rapid exchange of updated information. A user simply clicks on that Update This Listing button that you see there when viewing a resource on the website. And then once they click on that, they're going to choose this option to publish a note. So please, if you have a moment, review your own organization's listing on our website and publish any updates you might have. Okay, I'm going to jump to our website for a minute to quickly show you some of the features I was just describing. Okay, so this is the homepage of 211ct.org. A couple of things I'll point out to you. The globe in the right-hand corner is how you translate the website and all of the search results into these 30 languages. You have My 211 account up here if you're signed up for an account. There's an option to chat, and here's an option to search our e-library, that library of electronic white papers. And a little bit further down, I'll just draw your attention to some of our specialized services that we're not talking about today, but if you want to learn more about any of those, our community events calendar. And then down here is that link to the 211 Navigator I spoke about earlier, that online screening tool. But really what I want to do today is just do one sample search to give you an idea of how to search the database for resources. So if you wanted to find food resources for a patient, you could start to type in food, and you'll get this auto-suggested list of resources we have in the database. Maybe we'll select food pantries, and then we're going to put in a location. So usually I'm going to put in the location where the person I'm working with actually resides, because when the search results come back, they're going to come back in order of proximity to that location. So we could put in a zip code, we could put in a town, we could put in a county, or a physical address. So I'm going to put in 100 Main Street, Hartford. Let's say that's where my patient lives. And I'm going to click search. Okay, and I see here that there are 64 food pantries that serve somebody living at 100 Main Street, Hartford, right? And we could browse through this list of results using the cards on the left, or we could start to browse it using the pins on the map. But maybe I also want to search for additional resources for my patient. I don't just want food pantries, I want other food resources. So I can click on search multiple services. And maybe I want to add soup kitchens to my search. My patient might have small children. I want her to apply for a WIC. Perhaps I want to see if there's a community garden near her that she could utilize for fresh vegetables. And maybe I also want to try and get her connected with, let's say, some nutrition classes. So I can add all of those services to my search. I'm going to click search again. Okay, and now I have a list of 109 resources that serves somebody at this address in these categories. And so that's a lot of resources to go ahead and look through. So I might want to filter my results. If I click on Show Advanced Filters, I can filter this list of results based on target population, folks with AIDS, HIV, benefits recipients, or youth. I could filter by radius. So if my patient has limited means of transportation, I might want to find programs within 1 mile of where she lives. I could use this checkbox if I was looking for a program that was open right now. Perhaps she needed a hot meal right at the moment. I can filter based on day of the week. So if I want to find programs and services that are open on a Sunday or Monday, because let's say those are the only days she doesn't work. And I can also filter based on gender or age group. So I'm going to go ahead and filter my search. And I went from over 100 resources to a list of 23 resources now that are within 1 mile of 100 Main Street and are potentially open on a Sunday or Monday. So we can start to go ahead and scroll through our list of results, right? If we see a program that looks like it might meet our needs, we can click on more details. And it's going to give us the full description of this food pantry, eligibility, phone, fax numbers, documents required, hours, website. If we scroll down a little further, it'll give us information about the parent agency. And it'll also tell us all of the other programs and services listed at the agency locations. If I'm looking at this listing and I see that something needs to be updated, I can click on the Update This Listing like we described a moment ago, click on Submit a Note, and I can publish a note to the website. So maybe I want to say, food pantry is no longer operational, right? This is just a test note. I can go ahead and submit that. And now all the 2-in-1 website users can see that this update I've posted to the website, and our 2-in-1 resource department receives that note right away as well, so they can research, verify the information, and then make the appropriate changes to the database. Okay, so let's go back to our results that, let's say the patient I'm working with, we're going to start to build up a personalized resource list for her. So maybe I want to add this food pantry to a list. So I'm going to say, I'm going to give my list a name, say, we'll put my name, and we'll say Hartford Food Resources. I'm going to create my list. And then I might want to add additional resources to that list, right? So I can add another food pantry. I can add this nutrition education program. I can add this WIC location, right? I could add some soup kitchens. Okay, and so now we've started to build up a personalized action plan for this patient. If we want to view this list or any of our lists, we can come up here to My 211 account, go to Resource Lists, and here's my list here. I could open it up to see what I put in it, or I could share it. So when I click on share, I can email this to the client or patient with some notes about what we talked about and how to get back in touch with me. I could text a link to the list to the patient, or I could grab a shareable URL and embed that in another email or share it any way that I want. Okay, so that's just a quick orientation to the website. I'm going to jump back to our PowerPoint since we are almost at time. Okay, and so number 5, our last one on this list of kind of common features found in these clinical community integration programs is identifying and addressing resource gaps. And so this is really important because if you're a hospital or you're a community clinic and you are identifying a huge number of patients with a particular need, let's say, for example, transportation, but you can't find any transportation resources to help them, then what are you supposed to do then, right? And so, one thing to do is to have those unmet needs tracked and displayed to be used, to have that information used hopefully by those in positions to affect resource allocation. And so by using 211 by phone and soon also by doing the website searches, that important data gets aggregated and displayed on 211 Counts, which is our real-time online data dashboard. And unfortunately, I don't have time to demo that data dashboard today, but I do encourage you to play with it a bit in your own time to see what are the top needs in your community and which of those go unmet because there aren't available resources. And lastly, very quickly, we wanted to leave you with some other good state and federal resources for more information on health-related social needs and more information on developing clinical and community integration programs. So this is certainly not an exhaustive list, but it's a snapshot of some of the resources we find particularly helpful. Okay, so thank you all so much for tuning in today. We are just about at time, but I just wanted to emphasize the fact that we really encourage you to reach out to us if you have questions or if you want training on 211 and the website for your staff or for your partners. We've done a lot of trainings recently for hospitals and community health centers for their staff, and we've even worked with AHEC and UConn to have 211 training integrated into the curriculum for their healthcare profession students. Also, if you need more information about anything that we touched on today or you have any other needs, please reach out. My contact information is there. Thanks again, everyone, for tuning in. Have a wonderful rainy afternoon. We have about 1 minute left in our time, so if there are any questions that you want to submit via the Q&A box now, you have about 30 seconds to answer them. And if not, please still feel free to chat in the questions in the Q&A box because we can provide written responses in the follow-up email that goes out to everyone with the PowerPoint and the webinar recording. Okay, thanks again, everyone.